Hello, thank you for joining us to hear an exciting announcement. I'm happy to share that we, HealthLinx, have entered a new collaboration with our longtime partners, Memorial Sloan Kettering Cancer Center, to support evidence-based practice in our client organizations. This partnership will provide the framework and structure for any organization that needs to improve their evidence-based practice program by giving them the knowledge, tools, and training to transform their culture of inquiry. Today, I have Dr. Ashley Hull, Program Manager and Head of MSK EBP Consulting with me, and we want to tell you about the program. But before we dive into the details, let me start with introductions. I'm Laurie Schulenberg, Senior Vice President of Nursing Excellence. I've been a nurse for 37 years, and I've been a Director of Professional Practice, a Magnet Program Director, and a CNO of Magnet organizations. In my role at HealthLinx, I oversee our talented team of nurse project managers, our copy editors, and our nurse scientists. Ashley, would you like to introduce yourself?
Sure. Thanks, Laurie. I'm Ashley Hull. I'm the head of MSK EBP Consulting, and as Laurie mentioned, I work at Memorial Sloan Kettering. I've been a nurse there for over 20 years, and my current role is to oversee our EBP programs.
Thanks, Ashley. As I said, we're now able to provide our clients with MSK's expertise on EBP. HealthLinx clients that we determine need support for EBP will attend virtual classes with the experts at MSK. We will discuss what those workshops are in a bit, but first, Ashley, can you explain a little bit about the culture of EBP at MSK and why you guys are deemed experts in EBP?
Absolutely. At MSK, we began our journey with EBP about 10 years ago, back in 2015. We had a few cohorts of our nurses and leadership take some initial EBP trainings, but we were uncertain how to take the next step, how to actually do EBP on a day-to-day basis and really enculturate it within our organization. For those that aren't aware, we're a large multi-site hospital with over 4,000 nurses. So we knew we had to come up with a strategy that would make EBP feasible for everyone, from our CNO to our novice nurse. We began building an EBP infrastructure, embedding the methodology into our policies and procedures, our shared governance councils, our job descriptions, and our clinical promotional ladder. Then we started offering courses to our clinical nurses to get them excited and interested about EBP. These classes really sparked a spirit of inquiry for our nurses, knowing this was something they could do and that we had the infrastructure to support them. We asked the nurses to start questioning current practice and wonder if there were areas we could improve. Our classes began empowering the nurses to make meaningful practice changes. Nurses started coming with great ideas or things they heard at a conference or read in a journal and questioning why were we still doing things the same way we've been doing for 20 years. We knew we had to develop more classes to support this spirit of inquiry. So we developed another class to train EBP mentors and another program to support nurses through the entire EBP process. And from there, things have really just taken off. We've had over 50 EBP projects implemented by nurses at MSK, and we have 60 EBP mentors that work to support all these ongoing projects.
That's really incredible. And I want to add that I've actually seen this in action. A couple of years ago, I was part of the HealthLinx team that does our initial assessments of potential clients, and I had the pleasure of assessing Memorial Sloan Kettering. EBP is truly the way that they make decisions, and it's bedside nurse driven. When I asked a question about anything, the answer was pretty much the same. We're members of our professional organizations, so when we identify we have an opportunity to improve, we go to the literature, see what best practice is, and then work through our shared decision-making team to put together a plan to change our practice based on the literature. They are really modeling this there. So let's get into the nitty-gritty of what this looks like. When we determine through our NEAP assessment that a client needs support for EBP, we will provide them with this MSK EBP Intensive as part of their project plan. We will work with the clients to set goals. There'll be an introduction of the MPD or the PPD to Ashley's team, and then they work together to schedule virtual classes. The classes are Introduction to Evidence-Based Practice Workshop, Critical Appraisal Workshop, EBP Mentor Workshop, and the SEEK program. Ashley, would you like to describe the content of each workshop?
Sure. So the Intro to EBP class, as we abbreviate it, is a 90-minute virtual class that teaches participants how to create a successful search strategy using PICO keywords. It helps them to do a comprehensive yet efficient search. The critical appraisal workshop is also a 90-minute virtual class that teaches people how to critically appraise the literature. We describe the different types of studies and how to break them down in order to evaluate the quality of the research and determine if it's an article that can be used to make a recommendation for a change in practice. The EBP Mentor Workshop is a 3-hour virtual class where we get a little higher level with those that are really passionate about EBP and have experience with EBP implementation. We train them on how to mentor someone else who is doing EBP, how to navigate the barriers, how to successfully implement and manage a practice change. I will add that having a structured training for our EBP mentors is what really moved the needle for us. To have successful enculturation of EBP, you must have strong mentors. So this class is really crucial for that. Finally, our SEEK program is our 3-month virtual comprehensive EBP program. For those places that already have strong EBP mentors in place and feel they're ready to fast track it to full-blown EBP projects, this is a great option. We think all of our other classes as the a la carte menu, but SEEK is really the full tasting menu. You get it all. This program is for clinicians who have a project idea and want to take it all the way through implementation, outcome measurement, and dissemination with mentorship support. All of the EBP content that's in this course can be used to help guide clinicians within your institution to implement successful EBP projects.
Great. And Ashley, what's the format of all of these classes?
The format for all these classes is a train the trainer situation, meaning we teach a cohort at your hospital the class, then we train you on how to teach our material to others at your hospital. So essentially, we want to save you the 5 years and the plethora of resources that we use to create all this content and give you the jump start to use it right away with your nurses. The content works. It works for real life clinicians who are practicing outside of the classroom. And that's what we really feel sets us apart from many of the other EBP training classes, which just teach you the content and then sort of expect you to figure out the rest on your own. We figured it out, we've done it, and this is how we did it. And our hope is to be able to share all these tools and information with you.
That's awesome. So just to be clear, following the training, the client begins working with their HealthLinx project manager to actually implement a project or 20. Whether the client is on a journey to magnet or pathway to excellence, you need EBP, not only for the designation, but because it's the right thing to do. Ashley, do you want to add anything?
I love that you said that, Laurie, because it really is the right thing to do, not only for our patients, but also for our nurses. As I mentioned, the empowerment that we have seen these classes give to our nurses is really what has motivated us to start this consulting opportunity. Nurses are inherently looking to make things better, right? They're always wondering, how can I make my patient more comfortable? Or how can I make this situation better for them? EBP is that tool. It teaches nurses how to use the evidence to improve their patients' lives. It gives them purpose. It gives them structure and an environment that can be chaotic and apprehensive to change. We have nurses who knew nothing about EBP. They take these classes and they go on to lead a major hospital-wide practice change. They publish a manuscript on their work, and then they become an EBP mentor. That's really a full circle moment for us and what makes this work really rewarding.
You know, as you were talking about that, it reminded me that this is really what drives the difference in the answer to this question. When I used to ask in my assessments about, you know, how do you know when you need to make a practice change? And in some organizations, I would hear administration tells us or the physician tells us. And this is really driving a culture where the nurse is identifying and the nurse is telling us what we need to do to improve. So it's really powerful. To give you a little more information, we thought we would address some questions that we've been asked about the program. The first one is, have you done this with any organizations yet? And what is the feedback? And the answer is yes. We have piloted this program and the feedback has really exceeded our expectations. We are conducting a pre-training survey, a post-training survey, and a survey 1 year after implementation, and the results have been very positive. We plan to add one more survey in the mix so that we will be able to achieve 3 data points, and then an organization could actually use this for an EO in their magnet document. Another question is this only for large hospitals that are pursuing magnet? And the answer is absolutely not. This is for any hospital that wants to improve EBP. We actually see a really great need in smaller organizations, small community hospitals, critical access hospitals, all the way up to the largest academic medical centers can benefit from this offering. How long does the intensive last? Ashley, I'm going to throw this one to you.
Sure. So while the courses with us may be completed within a few months, your HealthLinx project manager will be working with you on implementation of projects throughout your journey. We at MSK EBP Consulting will remain available for support, questions, anything you need. We're just a phone call away.
Awesome. So why are we doing this? Because we recognized a need. Many of our clients have some sort of EBP program in place that the CNO and leaders know about, but it's not really the foundation of practice change. And when we were given this opportunity with an organization like MSK that truly is the expert and the leader in this nationally, we just jumped at the opportunity. A lot of hospitals don't have a culture of inquiry where nurses are passionate about always providing the most cutting edge best practice, and we want that we want to change that. Bedside nurses recognize opportunities, but they don't always know the next steps to fix things, or they don't feel empowered to bring their ideas forward. And we know by partnering with us and MSK, organizations can have a culture where bedside nurses really own their practice and feel confident in their resources for EBP. And then most importantly, they know the steps to take when they recognize a need. Okay, so last question. What resources do hospitals need to have in place to be able to get the most out of this and be successful? Ashley, can you take this one?
Sure. So number one, I think having a supportive CNO and executive leadership is crucial. Number two, having access to a library for searching online journals is really important. That's how the EBP process begins. So having access to research articles is going to be critical. And then lastly, you need at least a handful of people who are willing to start this movement with EBP. These could be people of any position. For us, it was a few clinical nurse specialists and nursing educators. But honestly, we probably only had about 5 people who were initially teaching these classes and helping with projects. And now, as I mentioned, that pool has grown to over 60 EBP mentors. And these are all people who were not made to do this. Our mentors and our instructors for classes, they want to do this. Many of them come to me and ask to be a mentor. They're passionate about EBP. They believe in our mission to embrace and implement change across the organization. And this is what having the right classes and infrastructure in place will do to your institution. It will really transform it.
That's awesome. Well, that's a wrap. If you would like to improve your culture of nurse-driven, evidence-based practice, and as Ashley said, really transform your culture, we would be thrilled to talk to you about what a partnership with us could look like.